Good evening, everyone. My name is David, and welcome to another ACPP webinar and the continuation of a regular set of professional development opportunities the college will be running. Before we begin, I would like to acknowledge the traditional custodians of the lands where my Australian-based colleagues are located today and pay my respects to their elders past, present, and emerging, for they hold the memories, traditions, cultures, and hopes of Aboriginal and Torres Strait Islander people. In recognition that we are a binational college, I take this opportunity to acknowledge the Maori as Tangata Whanoa and the Treaty of Waitangi Partners in Aotearoa, New Zealand. This evening, I have the pleasure to introduce you to our guest speaker, Jacqui Wilkinson. Jacqui is a registered paramedic. She's currently working for HMS Collective in the Macedon Ranges in Victoria. Jacqui has a passion for the role that paramedics can play in primary healthcare environments and is a strong advocate for the fact that not all paramedics work in ambulances. Jacqui will be talking today about the benefits that paramedics can bring to the community and multidisciplinary teams and how the HMS Collective model operates in Victoria. At the end of the presentation, there will be a short Q&A, and if you have any questions, please write those into the comments section and I'll do my best to go through them in order as they appear at the end of the session. Without anything further, I'd like to pass the webinar on to Jacqui.
Thanks, David. Hi, everyone. I'm Jacqui, community paramedic from HMS Collective in regional Victoria, so Central Vic for those of you who aren't sure where that is. As Dave's already said, I work for HMS Collective and we are one of the first community paramedic groups in Victoria providing back to the community and working outside of ambulances. So firstly, I'd like to also acknowledge our country and the traditional owners and custodians of the land which we stand on today. So for us in Macedon Ranges, that is the Djaja, the Tangarang and the Wurundjeri people. I also like to pay my respects to the elders past and present and the elders from other communities who may be here today. So firstly, a little bit about community paramedicine. It's still a relatively new concept. People go, what's a community paramedic? Where's the ambulance? They're some of the common themes that we seem to come by. We're constantly saying, we're not working in an ambulance. We're here in the community. We've driven our own car here. We're here to keep you safe at home and provide care for you. So all of our community paramedics have to be APRA registered as the regulations are now. We have a range of experience from HMS Collective, so ranging from fresh out of university, so 1 year, to 32 years of experience across the board. Our community paramedics also practice in the community where they get to keep people safe in their homes. And if someone is so unwell that they do have to go to hospital, we are going to make that call and organise that for them. But our main priority is keeping people out of hospital and ambulances and reconnecting them to their general practice, society, and the rest of the community, because we all know it's been quite tough for people over the last 2 years. We also like to work as part of a multidisciplinary team and keep in mind that we can't do everything alone. We do need those other people to make everything work. So how HMS Collective has these paramedics and how it came, we have a mission that we really abide by. So it's to utilise highly qualified health providers in partnership with people to enable health, wellbeing and safety within their communities. So this is something that we strongly believe in and have quite a rigorous process in terms of selecting those community paramedics and making sure that they have the qualities we need to give that care to those people in the community. Our community paramedics also can deliver care to a wider range of community members. So not just anyone who's calling an ambulance, but this might be private people that don't have any funding. They just are happy to pay for their own care and just want some help at home, or they might have other medical concerns, people who are on an NDIS plan, or people who are on my aged care. So the elderly side of that have some funding from the government and need some more support at home. Our community paramedics also are the gap in those community service settings. Quite often you'll see that people need help, they need healthcare at home, and the only option they do have is calling an ambulance when we all know that it's not necessarily appropriate for them. So our role is bridging that gap, giving them the healthcare that they need and making sure that they get that in a timely manner. A lot of our community paramedics have luckily done extra skills before they come to us, which we're very grateful for. As a community paramedic is not legally defined yet, APRA, it's not registered with APRA in terms of what a community paramedic is at the moment. It's not embedded in the law, but they still have to be registered with that general registration with APRA. ACPP is working on some of those definitions at the moment as well. We are quite lucky that our community paramedics have had other qualifications such as podiatrists, nurses, pharmacists, just to name a few of them. And some of the other competencies that we have as mandatory, which we have found that our community paramedics really need to be able to provide that effective care in the community, is things like falls prevention, aged care and disability care, making sure that you've had an NDIS work orientation, Palliative care is a really big one at the moment. We have lots of people that need palliative care support but can't access it. The people in the community are really struggling as there's just no one available. So it's been a fairly big aspect of our work. PEG tube and catheter care, especially for people who are from TAC incidents, this is a really big one for them. Physical assessment, more than just you would learn at university. Wound management, occupational health and safety, and working safe remote practices, and also working by yourself. Counselling and mental health support, medication administration review, autism and ADHD care, learning Auslan for those people that are unable to talk and use sign language. And we also have further ongoing CPD, which we're currently developing all the time. So a typical day as a community paramedic for myself. Firstly, I'd like to say, as you probably all heard before, no 2 days are the same. What I walk into one day is definitely not the same as what I'm going to walk into the next day or even another day. It's always about providing supportive care to that person requiring the support and that care, but also to their families and their carers as well, because they're the ones doing it tough when they're there at home by themselves. So sometimes it might include connecting people to other services, wound management at home, medication management, that palliative care that I spoke about before, advocating at medical or specialist appointments, and much more. We also have support dogs, which we do bring to some of our visits. So it's not always just a medical-based visit, it's always about making sure that we can brighten up their day and think of other things that are outside their norm. So the benefit to the community of having a community paramedic is that we get a holistic healthcare approach. So it's better than just that going to a GP or having the hospital as the only other option. So we then get to bridge that gap between primary healthcare and the person, and hopefully prevent unnecessary hospital visits where the person has another option to choose from their health at the moment. So healthcare is also very beneficial to vulnerable people. This is generally those in diverse communities, the elderly, individuals living in rural or remote areas, or even isolated areas that have limited services. We all see too often that these people really struggle to get healthcare because they just don't have the access to it. We also like to make sure that people's healthcare wishes are met. So a really good example of this is enabling a palliative person who has had a condition that is unable to be fixed with any medical intervention, and they've unfortunately reached the end of their life. We are able to make sure they pass away in the comfort of their own home or their own place of choice, make sure they have the healthcare they need and they have all their wishes met. So we've recently done this for one person, and we're just about to do this for another one as well in HMS Collective. So it's something that we really value being able to do for those people in the community. So community paramedics is an evolving role. So as I said before, ACPP is working on the frameworks and the definitions of community paramedics, but also for others. So as you'll see, I've written those postgraduate course accreditation. So that's for our community paramedics, primary care paramedics, and paramedic practitioners. We also would really love to gain government recognition and funding, as currently everyone just sees there's the ambulance, they've got the funding, and anyone outside of that is often forgotten. We also like to get professional recognition of the paramedics working outside of ambulance services, so there isn't just one employer for anyone who is a paramedic or would like to do further education in that field. We also like to give paramedics a choice of practice. So as I said, working in an ambulance and working in community paramedics are two different things, but we still don't ever do the same work every single day. So having a choice in what you would like to do and the pathway you want to take in paramedicine is really beneficial. I'll hand back over to David now.
Well, thank you very much, Jacqui. That was really interesting. I think it resonates with a lot of us about the point that you were making regarding not every day being the same and having a series of clients with differing needs and complexities. It's actually a really interesting role. I might just start off the questions here. Would I be able to ask regarding the types of patients you see, what would you say is the most common presentation that you're called for? So you said you can organise appointments and people, and you can come out to people at set times. But if someone was to call you on the spot and say, I'd like a community paramedic to come out to me now, what are the kind of presentations or questions or issues that they have for a job like that?
Yeah, so that's a really good question. Common things that we're often called for is for when people come out of hospital and they're seeking that home care help that they need, but nothing's been set up, or they were told, we've got someone coming in a week's time to check how you're going. They come home, they've got all these new medications, they might have some wounds that need dressings, or they might have other things that need to be taken care of, but they're not sure how to do it. So we often get called for what we would call a full health assessment. So we would spend about 3 hours for that visit, going over absolutely everything with them, working out a plan for their care moving forward. And then depending on what care they required, then we would put those things into place for them. Other things we do get called for are often we've had some COVID testing requirements and other blood tests, just mainly for the elderly and those who don't have transport options because they can't get down to those clinics. So us being able to go into their homes and do that has been really beneficial for them.
Thank you. Does anyone else have any questions? Feel free to pop those into the chats and I can read them through if you do. I might follow up with one that I got an email from just before the session started today asking about funding. You did mention NDIS and private funding arrangements. What would be the average patient that you see? How is the average patient funded? Is it through NDIS? Is it privately? Have you got a split across the board as to how the funding is arranged across all your patients?
Yeah, so predominantly most of the funding actually comes from my aged care. So generally anyone over the age of 65 who's eligible can be on one of those plans, providing they meet the criteria. They then are allowed, or they're given an allowance depending on what level of care that they need. So most of our funding at the moment comes through those home care packages for people in my aged care, but we do have a few on NDIS and some that are private. The other thing with funding is obviously not everyone has my aged care or NDIS and they can't pay for it themselves. So we're currently trying to set up a charity to be able to give back to those people that can't afford that but still need the healthcare that they require, and also lobbying to the government to get some Medicare funding or be eligible for Medicare so that we can do other care for people, because we all know lots of people go to hospital because they don't have to pay, whereas a lot of GPs are trending towards a gap payment at the moment. So having that Medicare funding would really bridge that gap even further.
Right, we just have a question here from Matt Wilkinson Stokes. I hope I'm pronouncing that right, guys. Is your scope of practice at HMS as an employer or under your individual ARPA registration? If the latter, which medication skills would you like to see added to your autonomous right to practice? And he's used an example of Medicare benefits and pharmaceutical benefit schemes there. So I guess that the question is, how is your scope of practice defined at HMS? What would you like to see added? And what do you think the future is with prescribing rights and access to MBS?
Yeah, so really good question from Matt there. So ultimately at the moment, because APRA just has a general paramedic registration, there's no definition between like an ambulance paramedic, community paramedic, or anything further at the moment. So HMS and myself working with HMS operates under their kind of criteria. So we have to make sure that we've done all of that extra competency training, and we're only allowed to provide care that we've been trained in, just as any other requirement from APRA would want that as well. So we don't want someone to be going out and, I don't know, doing something that they've never done before and they think that that's fine because it's not okay, and it doesn't abide by all those APRA regulations and rules, and doesn't abide by our values as well. In terms of medications and skills that I'd like to see added, we're currently going through a process through HMS of adding lots of skills at the moment so that we can provide more care, such as like PEG tube changing, catheter insertion, so IDCs and SBCs. Other things, so for ports, for example, people that have medication and they're only allowed via a port. So there's some other things that we're currently working on, which I would really like to see added to be more autonomous for our work. In terms of medications, currently we can't prescribe. So that's where the paramedic practitioner role would come in, when they would be eligible to prescribe according to Medicare and all the MBS numbers and all that other regulation stuff that's well above my head at the moment.
Would you be able to see a role for a paramedic practitioner as part of your team? Definitely.
It's something we already have noticed that we need, and hopefully in the very short future we'll be able to have that.
Paul has written, hi Jacqui, ADHD. So what are you currently doing to treat this condition at HMS? Is there a process that you go through with patients who do suffer from ADHD?
Yeah, so that's another good one. We don't necessarily do any treatment for ADHD. What we do is work with the person. We make sure all of our employees have awareness of ADHD and how to look after people with ADHD. So we don't want to be diagnosing anyone to say, you've now got this. They need to still see the right channels to be able to get those diagnoses. In terms of it's just more about our awareness of knowing what their triggers might be, how they need to be managed in terms of if they do have a bit of an episode or there's something that really sets them off. So it's about learning how that person actually behaves and what their needs are instead of treating the condition.
Daniel Pendergast, again, I hope I'm pronouncing that surname right. Jacqui, how do you manage the relationship with traditional healthcare practitioners where there are common skill areas? Is it generally positive, or is that still evolving over time? It's a good question.
Yeah, so firstly, I guess that relationship, when we first touch base with those other healthcare practitioners, they still have that same assumption of where's the ambulance, why are you here inside and you haven't got a uniform on, kind of thing. So it is evolving at the moment, but once we've had chats with them and explained what a community paramedic is, how it can benefit them in the community, how it can reorientate those people back into their general practice, they've actually been really positive about what we're doing and how we're doing it and have recognised the need. So we all know that nurses and doctors and all those other specialties do a really great job, but we as one profession can't do it by ourselves. We all need to work together. So they've shortly come to realise that over the chats we've had with the local ones here, and they've all been really great towards understanding what it is and how we can all help them.
All right. Andrew has written, how do you manage referrals to other services and what systems can be developed to improve that referral service and pathway?
I think for this one, I'll first start off with for us receiving referrals. We can receive referrals by anyone. We're not limited to whether it's a doctor, a nurse, a hospital, etc. Anyone can refer anyone else or themselves to that. And in terms of managing referrals to other services of the people that we do see, it's all on a case-by-case basis. So I'm not going to ring up someone on the phone and say, I've never met you, but I'm going to do a referral, because that's not right. We will need to do a visit, understand what that person needs. And if they do need a referral, then we will personally write those referrals to that service.
Alison Spicer has written, how do you get on with medication administration given the limitations of the Poisons Act? She's here assuming that you're assisting patients with administering their own, or do you have any other guidelines or medical oversight regarding that?
Yeah, good one, Alison. So at the moment, as I said before about the paramedic practitioners being prescribers, and we currently aren't. So we are obviously giving medication that's already been prescribed for them. So people generally have a whole range of medications that they're on. We would just come out and make sure that they're being administered properly. So it might be through a Webster pack. We might have to draw up some medication that's PRN. Just depends what kind of medication that person's on. But we're definitely not prescribing anything, just working with the plan that they already have.
So Heath McSullivan, I hope again I'm pronouncing that right, guys. It might have been said already, but what qualifications do you need to be a CP? And do you need to be a qualified paramedic or GAP or completed paramedic student? I'll let you answer that first, and then I can just speak on behalf of the college very briefly at the end of that if needed.
Yes, good question, Heath. Qualified paramedic, according to APRA, is someone who's completed their university degree and has their registration. So that could be taken a few different ways. We are not fussy in terms of whether you've done a grad year, you haven't done a grad year, you've decided you don't want to work arrangements, or you do. The only thing that we require is that people have to be registered with APRA to become a community paramedic with us, and you have to do the competencies that we set out. So without them, employment isn't a possibility.
And Heath, as Jacqui alluded to just earlier on in her practice as well, the college here is working to standardise and have a common language around what constitutes a CP, PCP and paramedic practitioner. The current stipulation into the future will be that a community paramedic will be a paramedic with postgraduate certificate level of qualifications in specific areas of primary healthcare, and all that information will be coming out into the open and for public discourse early in the new year. Matt Wilkinson Stokes, I think this might have been answered. How do you receive referrals? So I think we touched on that. Are there any other ways of receiving referrals that we haven't discussed, Jacqui?
As I said before, anyone can send a referral to us. We have some people just ring up and say, I just want to know a bit more about it, see if it's the right thing for me, and so forward. Then we would generally send out an email with some of our referral documents, or if that's not the case, then we would arrange for a visit to be able to do that referral for them to fill out that required paperwork that we need.
And Alison, I suspect this might be a continuation from your last question with regards to response from Ambulance Victoria and medications. I presume that if there is some sort of medical emergency or any reason why a patient may require transportation to hospital, would I be right in assuming that Ambulance Victoria would then be integrated with that patient and you would hand over to them for continuing care?
Yeah, completely. The only exceptions, I guess, to that would be, say, a palliative care person who wants to pass away at home and we don't want to go against their wishes. But otherwise, we would then hand over to Ambulance Victoria if that person needed that emergency care and hospitalisation. In regards to the response we've received from Ambulance Victoria, so far has been fairly positive. Obviously, people are still a bit unknown about what our role is because typically it's just an ambulance role for a paramedic. So it is a fairly new role that we have as a community paramedic outside of the ambulance. But in general, most people, as soon as they hear about it from Ambulance Victoria and other services, have just been amazed and are so grateful that we've got it up and running.
And Matt has written here, what do you see as the key changes to progressing your role in its broader adoption? So e.g. upper specialist accreditation or access to MBS. So what do you see as the key changes that you'd like to see to expand this role of community paramedicine and primary care paramedicine specialities?
Yeah, so I definitely think progressing and expanding this role, as you said before, David, is getting those grad cert, grad dip, master's courses accredited across the board. Everyone has a set level of knowing what you have to do to be at a certain level. So that would be the next role. Obviously, we've still got our extra competencies to make sure that people that are working for us as community paramedics have completed and are skilled in those areas. Otherwise, it's up to AFRA whether they would like specialist accreditation. That's not my area to discuss for what they want to do. Medicare would definitely be a big one that we would like to progress our role. It would just open so many doors for people that can't get healthcare currently.
Well, thank you very much. Does anyone else have any other questions that haven't been written down? Or any clarity on what she was talking about earlier? Well, if the answer is no there, that's fine. Jacqui, thank you so much for speaking with us today. I know that there are a lot of people who are really interested in this space, and it's a growing, interesting space to, I think, every paramedic. And what might have been something 5 or 10 years ago is not really being thought about or not being a possibility is now becoming a possibility. And I think that the roles for paramedics are expanding widely. Paul's just mentioned here, funding is the issue with progression, and ACPP are leading the way into developing those frameworks. So yes, as you have touched on as well, funding and how that and how we access that is going to be a continuing conversation into the future, and lots of groups are advocating heavily in that space, which is fantastic. So thank you all very much for coming. I appreciate your time. I hope you all have a good evening, and we will be running another webinar at the end of January. So I wish everyone a Merry Christmas, a Happy New Year, and I look forward to seeing you all in the coming year. You take care. Bye-bye.